Kisumu is a lovely place, rich in everything. We are fun, business-oriented people. Kisumu is the life of Kenya. But in my community, there's a lot of barriers, especially for women and young girls, in terms of HIV prevention services.
While the HIV infection rate in Kenya has fallen significantly over the last decade, women and girls are still very much at risk. My name is Rena Effendi. I'm a social documentary photographer. I'm drawn to stories about human resilience. All right, beautiful. This story is about a young woman called Brenda, who is a community advocate trying to help build a bridge between women that are at risk and modern medicine. So you volunteer 40 hours a week, right?
Yeah.
What motivates you to do this kind of work?
Growing up, HIV was talked about, but women and girls were not included as much. So when I got into the field of HIV prevention, I made it a point that I really want these women and girls to have a feel of what it means to take charge of your health. So I think that is what motivates me. And also looking back at my story, it's something that really keeps me going.
Can you tell me a little bit about the story?
So I was in a discordant relationship. That means my partner was HIV positive and he was not consistent with his medications. So at some point, I had to protect myself, especially when I got pregnant. So yeah, that is how I got into PrEP. Seeing women and girls my age get into matters that they have no control over, it's a life that I've lived and I wouldn't want someone else younger or my peer to live through it.
Yeah, that's probably why you're able to win the trust of the women, yeah?
Most probably.
What do you think prevents them from going to the clinics on their own?
That's a very big challenge. The main trade in this region is fish. It's demanding. The traders and the fishermen are very busy. So they hardly get the time to go to the facilities to get their medication. My goal is to spread the word, create awareness, and let them know that there is PrEP and this is what PrEP does. Because for me personally, when I hear PrEP, I hear freedom.
So what started as a personal decision has now become a calling for you?
Yeah, we can say that. Yeah. So my approach is basically woman to woman. I start the conversations on a lighter note, just checking in on them. I see if they have an interest in getting to really know what PrEP is. And from there, I can take them to access the services that they need for free at Lumumba sub-county. That is where we have Jared, the clinician. Jared has it all covered and he does a really great job.
How are you, Brenda? What do you have for me today?
I have 2 clients for you today.
Working with the community volunteers like Brenda was very important because I, as a service provider, we don't work within the community, but this is now one of their own who are on the same medication. So they talk from experience.
So tell me, what are some of the barriers that prevent people from coming to the hospital?
Stigma is the main one, more so for those who are HIV positive. And even for those who are HIV negative and are on PrEP, they feel they will see someone whom they know. If people see them, some people might not differentiate and they will be mistaken of being HIV positive. So that one also hinders them from coming. So for those who are willing to take PrEP, I will take them through the available PrEP or choices we have. With the long-acting PrEP options, they come, they get their services, and they walk away without anybody knowing what they have.
Community advocates and clinicians who are in the community play a very vital role because they are a bridge. We need to think about how do we meet the needs of those who are the most disadvantaged. Sadly, young women remain the eye of the storm.
I have lived with HIV over 20 years, so I have experienced different variations of stigma even before I knew what stigma was. So I was a pretty normal young girl, just out of college, first job, just went to get tested, and all of a sudden I had a disease whose face was death. It's the disease for poor people. It's the disease for people who did something wrong. It's the disease for people who are careless or something. And there's so much self-blame that comes with this disease.
You know, I've been around long enough that I've lived through the days when we had no treatment. when HIV was a death sentence. So to come to the place where we have options of treatment and options of prevention is really a great stride forward. I think prevention is not just the key. It may be the door itself to ending the HIV pandemic.
So it's the whole cycle of global to local, working with pharmaceuticals, regulators, governments, funders, all of us who are able to come together.
Partnership is critical. Collaboration with local partners allows us to see the innovation have its desired impact, which is to have a future generation that is HIV-free.
So what is your hope for your future here?
Just want a community where PrEP is not stigmatized anymore. I really hope I could keep enlightening more and more girls so that we have more champions like me in future. I just want to take it to a different level. Yeah.
Next level.
Yeah.
Thank you what you're doing for the community. Been very inspiring for me.
My motto is no new HIV infection under my watch.
I have always looked at everyone involved in this work in appreciation.
The heroes are really the people that are on the ground, that are on the front line, that are establishing those trusted relationships. They are the people that make the difference.
I believe we can create the future we have all said we want to achieve. A HIV-free generation.